Hi, this is Dr. Eric Codner from Southwest Georgia Center of Medicine and Colombus Physical Medical Center in Columbus, Georgia. Our patients, we get several calls every week with patients injured in auto accidents, and they ask us, hey, how can you help this pain I have from, I got rear-ended, or I ran into someone, ran off the road into a ditch, or maybe, hey, it didn't have to be an auto accident. I slipped and fell, slipped in the tub, hit my head. Personal injury accounts for one of the biggest drivers of permanent impairment, disability, chronic and lasting pain beyond that accident. And I find that the attitude by most emergency rooms, many medical physicians, even some chiropractors, physical therapists are kind of a skeptical, to put it nicely, skeptical attitude about people injured in accidents. I'm here to tell you that research says even at accidents 30 miles an hour or up to 30 miles an hour, low impact accidents can lead to, and there's certain research that shows it's more likely to cause spinal ligament injury. Now, what is spinal ligament injury? Well, you can think of spinal ligaments. Everyone knows what their spine is. That's your neck and your back. Well, you have ligaments that hold the bones in alignment. You can think of them kind of like bungee cords. If you've ever took bungee cords and held, strapped something down in the back of a truck with a bungee cord, that's kind of like the ligaments of your spine. They strap the bones to each other so they don't move out of place. Well, during an accident, because particularly if you don't know you're about to be hit, you're hit by surprise. The way the cars are made now, they have crumple zones, but those crumple zones don't crumple, kind of like if you took a Coke can and crushed the Coke can, they don't crumple unless the impact is high, let's say 50, 60 miles an hour. They don't crumple. That crumpling actually absorbs a lot of the impact of the accident, and so it doesn't get passed into your body. Now at 30 miles an hour, there's no crumple. The car stays rigid. The force passes through that car, through your body, snapping your neck and back around, injuring those ligaments, those bungee cords that hold the spine in place. Once those ligaments are damaged, once they're stretched out or torn, they'll never be the same. And this can result in a 25% or more whole body impairment. And I said whole body, meaning everything's going to be affected. This is a bigger deal than, let's say you, God forbid, you're in an accident and get your pinky chopped off. That's not going to affect your whole body. It's still terrible, but it's not going to affect your whole body. Your spine does affect your whole body, from standing, walking, driving, reading a book. You have to use your spine to do that. And once these ligaments are injured, that's it. And I see these injuries time and time again, in spite of the patient going to the emergency room. They did x-rays, told them they were fine, sent them on their way. We do our specialized x-rays, which aren't standard x-rays. We use a spinal stress series of x-rays using a digital x-ray unit, and you can see these problems. And we confirm them with a second party, a radiology group that reads our x-rays and says, yeah, this person is indeed injured, and have it signed off on by a medical radiologist who specializes in spinal injury. And our patients not only get the treatment they need. First of all, they find injuries they didn't know they had, so therefore then they can get the treatment they actually need instead of just painkillers. We have a specialized set of injections and different therapies that can help heal this problem, limit it as much as possible. But it also helps their case. If you go by what most emergency rooms tell you is wrong with you, there's nothing wrong with you, according to them. And you got a pulled muscle at best. This is way more serious than a pulled muscle, and it happens all too frequently. So do yourself a favor. Don't just go to someone who doesn't specialize in spinal injury. We specialize in it. We know how to spot this, and we know how to treat it, and we know how to document it so it can help your case. And Most of the time, like I say, your typical family medical doctor is not going to know about it. The typical chiropractor doesn't know about it. And even the lawyers that should know, at least have an idea of some of the injuries that their clients could be having, usually don't know about it either. I usually have to educate them as well on the seriousness of the spinal ligament injury. So if you've been in an accident, either in the past or you've just been in one now, give us a call. We will sit down and talk with you, see if you're a good candidate for our care, and see if it's a good idea to go forward with any kind of x-rays to find this spinal ligament injury. And if you have more questions on this, we're going to be posting more videos about spinal ligament injury and other therapies we do to help car accident victims and other musculoskeletal problems as well. So if you want to set up a time for that, our number in Americas is 229-389-2038. Our phone number in Columbus, Georgia is 706-330-1389. And this has been Dr. Eric Codner. Thank you.